I'm Carolyn Nganga-Good, graduated from the School of Nursing in December 2007. I work at Baltimore City Health Department Bureau of HIV/STD Services as the Health Programs Bureau Administrator. Before I came to the University of Maryland School of Nursing, I worked at St. Agnes Critical Care Nursing. I worked in an ICU. While I was working in critical care, I found myself seeing patients who had been so sick and they came to the hospital too late, obviously. And while I was working with those patients, I felt, what else can we do with patients so that they don't come to the hospitals so sick, or how can we prevent them getting in that place in the first place? I started thinking critically about prevention and health education for patients, and knowing that most of them were coming there because of underlying issues such as, poor socioeconomic status, lack of access to quality food or healthcare, having work policies that they couldn't take off to go to the doctors. I was just impressed about dealing with prevention. So my next goal was I was going to come back to grad school for a nurse practitioner degree, but when I thought about the prevention, I was compelled to do something to do with public health, and that's why I chose to do the community public health nursing. My story is a little unique or funny, if you may say. While I was working at for my practicum for the program planning and evaluation, I was doing my internship at Baltimore City Health Department, and the skill sets that I learned from that internship for that 1 year that I was there are what I use today in my day-to-day work, and that was the foundation that helped me to transition from clinical care nursing to public health nursing. So I learned a lot on grant writing, on program planning and evaluation, and so many other things that we were able to learn in public health where I didn't have a background in public health at that time. So while you're doing your bachelor's degree, you get some leadership courses, but it's not enough to prepare the nurses to be able to address the issues. So if you have a bachelor's degree and working in the community, you may be able to do the needs assessment, you may be able to do the epidemiology and stuff, but by getting a graduate degree in community public health nursing, you get extra skill sets and knowledge that help you to be more grounded when you're trying to look for a job in public health. And it also gives you a higher level of competitiveness when you have a graduate degree than when you just have a bachelor's degree looking for a job and competing with other disciplines that are also doing public health. My scope of work is very broad, so on a day-to-day it changes. Every day would change significantly. So there are periods of time where we are working on grants. For example, like this time of the year, we are working on grant reports and reapplications for grants. And then there are times where we are working with our sub-grantees contracts. And then there are times that we are working with procurement issues or planning events for the community, or even planning for different education programs for the community that we have, the advocacy during legislative session, and it's just broad. My job kind of goes, it's mostly program planning. I manage most of our testing programs, and so in a day-to-day it just differs. It could be providing technical assistance to one of our grantees that is struggling maybe with retention, or being able to recruit patients for testing, or keeping patients in care. It could be anything. So it varies from day to day. And in public health, what I've learned is that your day is never the same. Every day is different. So one day you'll be dealing with a special case of a patient who's probably been exposed to a disease that you're investigating. Another day you'll be dealing with an outbreak, and another day you'll be dealing with just administrative stuff like ordering supplies or managing supplies, or just doing strategic planning for the health department. So it varies every day. As we all know that our healthcare system the landscape is changing, and it's moving from individualized based healthcare to more population healthcare. And nurses, public health nurses, have been doing this from time immemorial, from forever. And nurses have the skill set. Their standards of care based on dealing with the community, dealing with the public, and providing care to the public. So as a leader in nursing in public health especially, this is a critical time for public health nurses to be engaged and to be able to put themselves out there and showcase what they've been doing all these years. We are not very good sometimes at documenting what we do because it's our day-to-day job, and therefore we don't put it out there, disseminate it as much as we should, but as a leader in public health nursing, I think this is a critical time where we can help the nation as we navigate to the new healthcare landscape to be able to figure out how can we provide better care for the nation, especially in population health, and be able to improve people's health care.